Hey everyone, I'm Roberto,
And I'm Ramiro.
and our position statement was on acute management of cervical spine. All right, so to start off with cervical spine, we want to define what a cervical spine injury is. And based off the position statement, the National Athletics Trainers Association describes it as a structural distortion of the cervical spine column associated with actual or potential damage to the spinal cord. With that being known, we want to give some background on cervical spine injuries that have occurred in the United States. So in the United States, there's around 11,000 new cases a year. Some of the top sports that have cervical spine injuries are lacrosse, gymnastics, men's ice hockey, and number one being American football, which is associated with the greatest number of cervical spine injury. So in the position statement, they give us ways to manage cervical spine injuries, and that's what our presentation is gonna be trying to inform you guys on. So we're gonna start off with prevention, emergency action planning, maintaining or creating neutral alignment of cervical spine, equipment related issues and how to be proficient at it, and airway management and transportation.
So prevention is one of the main things we focus on, right, for a cervical spine injury. So starting off with knowing the safety rules for prevention and cervical spine injuries, um, protective equipment manufacturers, knowing knowing their policies on like equipment, also recommending and knowing how to size someone, and also keeping up with the maintenance of the equipment is key to prevention because we don't want to have a football player that is using a helmet that you could see there's a visible crack on the helmet, things like that. So that's something you have to look out for. Also educating coaches on tackling form. As an AT, that's something you want to also kind of do research or keep up with the literature is knowing techniques on how to tackle or things like that that come up. So just like on the image, it shows high risk will is because the athlete is doing like a spearing type of tackle, and that's high risk in cervical spine. While the correct way now is that the head should come up instead of going straight, and that will eventually lead to less cervical spine injuries. So as an AT, we educate the coaches so the coaches can then educate their athletes so that we overall will not have um, we'll have less cervical spine injuries. Emergency action plan. So the EAP is like one of the key things to uh, cervical spine injury or even any injury in general. But just knowing your venue specific EAP because all there's there's many venues with different EAP um EAPs. So that's why knowing the process to your location is important, especially during an emergency. So rehearsing it at least once a year is good, but obviously you want to practice it more than once a year with everybody that could be involved with either at a sporting event, like a game or a practice. And the people you want to most likely be practicing or rehearsing the EAP with is an athletic trainer, obviously, student interns, master students, even coaches want should get involved and know the procedure. So within this rehearsal, you want to know how to apply equipment such as using an AED, how to place a spine board, where to find a cervical collar, and how to use a cervical collar. And also, you want to learn through this EAP on how to properly uh, stabilize someone. So like manual, practicing manual head and neck stabilization techniques, and methods of transferring athlete into a spine board.
The next topic that we're going to talk about is cervical spine stabilization. So when it comes to cervical spine stabilization, if you know there's a potential spine injury or it's suspected, you want to make sure you neutralize the cervical spine and apply manual stabilization. If you were to go up to a patient, and their cervical spine is not in a neutral position, the position statement suggests that you would realign the cervical spine to minimize secondary injury. And the way you could have manual head and neck stabilization would be through hand grip or trap squeeze. The trap squeeze is the one that's preferred most from through the as stated through the NADA position statement because it gives you the most support, and it helps stabilize it more with the forearm with the use of your forearms. And you always want to maintain stabilization even after removing equipment. And because once you remove the equipment or in the process of removing the equipment, it becomes you have the chance of creating movement that you don't want. So you're trying to maintain that stabilization the most you can, even after applying a cervical spine collar.
Equipment removal is also another key thing to think about and do, obviously. Just some examples of equipment that an AT would potentially need to remove are like football helmets, shoulder pads, catcher chest protection, just a few examples. And uh, so knowing how to properly take these off is really important and having these in your med kit. So especially if a athlete is in need of rescue breathing, you need the equipment and you need to take their equipment fast. So you need for example, a quick release tool for the face mask to take the face mask off fast. You need a screwdriver as well, maybe some scissors in case you need to cut a jersey or some shoulder pad straps, or um, the chin straps for a football helmet. And always we always want to make sure we're minimizing head and neck movement when taking this equipment off. And obviously this taking the equipment removal, taking the equipment off gives easier access to chest, face, and head or airway.
Right. When it comes to airway, as was stated previously, you want to remove any protective equipment as quickly as you can because it allows to get those barriers out the way and gives you the opportunity to provide rescue breaths if needed. And when you're maintaining a cervical spine, you want to use a jaw thrust maneuver to create the airway if you need one. The last, if you can't find or you're not getting the airway management that you want, you would use the tilt head technique. And the reason you want to try to avoid that is because with the head tilt chin technique, it provides more extension to the neck, and then that's not something you would want to do when you're already suspecting a cervical spine injury. Following that, when it comes to transportation, you want to give as much information as you can to EMS. So you want to follow up with a SBAR, so which is situation, background assessment, and recommendation. And you want to let them know how they're doing as you progress from like the beginning of cervical spine stabilization towards when they're on the gurney and on the way to the emergency department. And as a certified athletic trainer, you should accompany the athlete to the hospital. So you could also provide the most information to either the nurses or the doctors that are attending the patient. That is all. Thank you.